I'll tell you what it looks like. So first of all, I don't have an office. This is my living room, and I do tele visits with people, which
Okay.
makes me accessible to people all over the world. Some even from your region have contacted me and worked with me. Um, so yes. And what that looks like is sometimes that individual comes to the Zoom meeting or the session on their own. Sometimes they have a support person. There is great variability in functioning in this population. So you can get someone with a serious mental illness, mental health diagnosis who is quite functioning and able to do this on their own. And then you have people who are not or are on has such medication side effects they can't function. And in that case, we have a support person sometimes. And then sometimes I will tell you, I will get someone on a call with me and I will think, oh my goodness, I don't know if this person is going to be able to do this. They are in such bad shape and they will surprise me. They will
Mm,
surprise me. So I never anymore put it past anybody to be able to do this intervention just fine. They really, the people you think who couldn't do it, they actually do beautifully often. And then what we do is I look at I have a degree in a postgraduate certificate in nutrition and integrative health. So I'm very interested in what does your diet currently look like? What nutrients are you possibly not doing well in coming into your ketogenic diet? We talk about supplementation. We talk about beginning baseline blood work. And then I have them begin to track their food using an app called Chronometer. And I just
mhm.
like to see what they eat. I just like to see what level of carbohydrate their body is expecting. I like to see the nutrient composition of their diet. Is it more bioavailable forms of micronutrients? Are they relying on less bioavailable forms? And then after I get the data back of about a week's worth of tracking or so, then we do macros, but often I will transition people down in their carbohydrates over 2 to 4 weeks. And I do that because when you transition someone a little bit more slowly, they're less likely to get some of the initial side effects of a ketogenic diet that are uncomfortable, like electrolyte imbalances, for example. And also, it gives them a chance to find new things to eat, right? And get used to how their plate is going to look different. And it increases the likelihood that they'll start their ketogenic diet and be able to kind of stay on it without being like, oh, I ran out of low carb foods and I don't know what to eat. I'll just eat this mango or whatever, right? So it really
Mhm.
helps that a great deal. And then um, we get them into ketosis and I have them continue to monitor their diet because I might need to adjust their macros appropriately, and we try to get their ketones into a therapeutic, somewhat sustained level. And then we just get out of the way and we let the ketogenic diet do what it's going to do. And you give them support, encouragement while they are on the diet, and help them troubleshoot any issues that come up. And that's basically what I do. And, sometimes my life coaching skills are helpful in my work with people. But yeah, that's what it looks like. Oh, you were asking about
Amazing.
medications. Yes. So I don't touch medications and I don't
Mhm.
talk about medications because I'm a non-prescriber. So before someone gets to work with me, they have to have a prescriber on their treatment team. I tell people to put together a treatment team. You can have me or another dietitian. You can have a psychiatrist or prescriber. Sometimes that's a general practitioner doctor that's managing their medications. And if they would like a psychotherapist or a psychologist to additionally be extra support on the team, they can be really lovely to have. Um, and and the psychiatrist does not have to be a perfectly ketogenic metabolic psychiatrist. They do not have to be perfectly informed. They do have
Yeah,
to be
yeah.
open to the understanding that they may need to adjust meds and agree to that. They need
Hmm.
to agree to medically monitor the diet. Many of them don't know how to do that. So, a lot of my work is teaching people how to self advocate for themselves with their prescribers and their medical personnel to ask for the things they need to monitor the diet. And then, just like I spoke about earlier in this very podcast, I really encourage them or their support person to take a hyperbolic tapering course or get knowledge about that before they have these conversations with their prescribers.